Hey everyone, welcome. I am Angela Love-Zaranka with Lactation Education Resources.
And I am Sekeita Lewis-Johnson with Lactation Education Resources.
Thank you all so much for joining us today. We are here to present the topic on how to create a study plan for the IBLCE exam. And so just a little bit about us. I worked in community support and peer support for over 30 years, and I've been board certified for, goodness, over 20 years. And I also served on amongst many other boards of directors, on the IBLCE board of directors, and have been with LER as an instructor for many years. Sekeita?
Well, I have 24 years of maternal child nursing with a solid 15 years of lactation support. I have taken the exam twice myself. I am also one of the instructors for LER, and I have taught at various hospitals around the Metro Detroit area. I serve as the accredited provider program director for LER, and I'm excited to be here to share the knowledge that I have with you on this afternoon.
Excellent. Yes, so am I. And so let's jump in today and get through the content so that you can be successful, so that you can be prepared for the IBLCE exam, which is just a few short months away. So if you'd like to ask questions, this is where you can find the interface. If you're using a PC or a desktop, you can, or a Mac, any sort of computer, you can find the question box here. You can see the little blue arrow. Or if you are participating today via your mobile device, like a cell phone, then you can take a look at the question box, which is down there on the bottom right, as indicated by the green arrow. And excuse me, that is also what you can use as the chat. So if you, for example, would like to chat in today where you are participating from today, we would love to know where in the world you're all located. So a few other things. We have a few people who are helping us with the questions today. We have Julie from our amazing customer support team. And we also have Jeanette, who's from our communications team. And we have Jill, who is part of our tech team. So if you have questions for any of us regarding tech, regarding the content that we're going to present today, please feel free to type them into the questions box. We will answer them at the end of the lesson, but we also, because Julie is not only a part of our customer support team, but she's also an IBCLC, she can answer a lot of your questions in the chat. And so we will answer the questions as we're moving along. We also have two handouts which are located either right next to the question box. And so if you click on the handouts, you can get the PDFs for a couple of, one is a study guide, how to set up a 30-day study guide for the IBLCE exam, and the other one are helpful URLs, helpful resources that you can use. So, okay, there's the housekeeping. Now let's go ahead and jump in. Sekeita, what are our objectives for today?
Okay, thank you, Angela. So this webinar is to help you get organized so you'll feel prepared when it's time to sit the exam. Understanding that nerves are high before an exam, hopefully will help you find ways to come back down without feeling so anxious. So when we're preparing for a big event, we know that our bodies sometimes forget what relaxation looks like. So I want you to just remember to take a moment and breathe, even if it's only for a few minutes, especially as you're preparing, even as you're listening today. It may seem a little bit overwhelming, the stuff that we're going to talk about, but just remember, just take a deep breath and let it out. And that sometimes seems to help with anxiety. So we're here to talk about the exam. Today's review will be helpful if you are taking the exam in the next 90 days or taking the exam in the next year. It's best to really get organized in the 60 to 90 days before the exam. So today we'll walk through a plan to help you feel calm, prepared, and confident. So first I'm going to talk about how to study for the IBLCE exam. So we all have different study styles. And what I want you to do is think back to past study habits that may have been successful for you, and then think back and avoid study behaviors that weren't so helpful in the past. So for some, flashcards are a great tool to help us get started. So if flashcards are helpful for you, it is really best to start making them now. I remember reading a study that talked about flashcards. So there are pre-made flashcards you can purchase, and then there are also flashcards that you can make yourself. And I believe this study focused on the fact that anytime you're writing in your own handwriting, it helps you to retain the information. So key things about or a little less well-known fact about writing as it relates to flashcards. So if you took our 90-hour course and you still have access, you want to review the entire course. Look over your notes from the course. Look over any of the resources that were given to you in our course. If you've attended any webinars that are relevant to basic lactation support given by lactation consultants or experts in the field, you want to take a look at those as well. The best advice that I would pass on is just to relax about memorizing. You don't want to memorize, for instance, the entire core curriculum. As a matter of fact, that might be impossible. I'm not sure. Some people may be able to. But for example, the cranial nerves, all the enzymes and living cells, don't try to remember those things. You want to focus on knowing the information instead of memorizing it. So, how to know what to know. It's not possible for you to know everything. That's fair game. That is going to be on a comprehensive, broad-based certification exam. The range of information can seem limitless, and IBLCE asserts that everything that has been published in books or journals up to this past year may be included. That's a lot of knowledge. However, keep in mind that the exam is an entry-level exam, and it's designed to separate those who will be competent novice lactation practitioners from those who will not be safe working with families. So I hope this puts your mind at ease that it is an entry-level exam. Since the exam is practice-oriented, the more experience you have, the better. If you've only practiced in one setting, consider widening your scope of practice by, for example, visiting local support groups. Maybe visit a clinic where lactation support and clinical care is offered. Now, I'm using the word visit loosely because I understand we're in a pandemic, but that could also look like visiting or speaking with an NICU lactation consultant via telehealth or via whatever virtual tool that you have. You could also maybe interview other lactation consultants that are in private practice. So even a few days or even talking to someone else who has a different clinical practice background than you've been working in can be very enlightening. So, Facebook group. LER has a Facebook group set for our students from either our lactation consultant training program or our exam review enriched course. It's not open to everyone, so you'll need to send a request and answer the questions to be added to the group, but it is open to our students. This group is a great way to discuss sticky questions, share helpful resources, and locate potential study partners. Study groups. I mentioned locating study partners. Sometimes it's helpful for accountability as well as focus to have a study group. So if possible, try to find a local study group or a study partner or a small online group of people with different backgrounds, but who are committed to consistent studying and meeting. If there are even a couple of you in the area getting ready for the exam, it really helps to bounce ideas off of one another, share anxieties, and share study resources. If you don't know anyone in your area taking the certification exam and would like to meet safely, face-to-face or virtually, put a request in the LER IBLCE exam study group on Facebook. Setting up a study schedule. So we've provided handouts for you, one of which is a study guide. So use a study guide. It's like a calendar to set up a study guide, and also a study sheet. You'll see what I'm talking about. So use the study guide that we provided for you in the handout section or attached to the recording to plan your strategy. Plan study time when you are most alert. If that's in the morning for you, well, if sometimes that's at night for some people, I would say that if you're coming home from work and you've had a long day, that would not be the best time, but it could be. So pick a time that's best for you. Any time that you pick, make sure it's time that you're least likely to be interrupted. And sometimes it looks like negotiating time with our family for time when they will just give you maybe an hour or two to just prepare and get your notes together and study whatever you're preparing to study for that day. All right, so this is a screenshot of the 30 days handout. It provides a list of topics on the IBLCE detailed content outline and activities you can do to prepare. Note that it's a 30 days plan. Of course, it's best to start more than 30 days ahead. Start now, 60 or 90 days prior, as I said before, and plan out when you can work on each topic. You may want to spend about 2 to 3 days on a topic that you're not very familiar with. Others, you can spend less time. If you start well in advance, you can plan a few days off for family obligations or take a break from your brain. The handout can be found as an attachment to this webinar, either live or recorded. All right, so this is a visual study plan. Now, some folks still like paper calendars, others have electronic calendars, but I think the general idea is still the same. So this is an idea of what a sample study plan could look like. Planning out dates, content, and a study partner can help you to remain on track and, as I said before, accountable. Of course, there are situations that arise, and we know that particularly being in this pandemic, it has urgent situations can arise. So it's important to remain flexible, but don't put it off that's last on your list. You want to prioritize accordingly. Angela once shared with me that when she studied with a friend. She had textbooks, her friend had others, and they would choose a topic and then study their respective books. Then they would meet and review similarities and differences in the information. If they found a conflict, they would find other resources to review and then come to a decision on the best information available at the time. Now, I mentioned this, and this is a great recommendation because there are times when textbooks and resources differ. So knowing this in advance can help minimize frustration. So get organized. Pull together all of your textbooks, lactation course study materials, set up a study place that is dedicated to your exam study, set up an hour to hour, a half hour block of time to do readings, practice tests, practice tests, practice tests, practice tests. Practice questions is extremely important. Study sessions should have the same weight as any other important commitment. I personally love the 5 Ps, and I love that these are wise words to live by. Proper preparation prevents poor performance. Personal study time is preparation, and it is extremely essential to your success on the exam. Research shows that material that is learned over a long period of time is retained better than cramming and waiting till the end. Repetition helps. So if you made it through high school or college using last minute cram strategy, don't do it for this exam. It's too important, and I'm gonna add, it's expensive. A reasonable amount of time will help you feel confidently prepared. If you are an experienced clinician or you're taking the exam for the second time, also make time to study. Don't assume that you can pass without studying. If you've been actively practicing as a lactation consultant and keeping up with your readings, attending conferences, maybe you can pass without studying, but you will feel awful if you don't. Reward yourself. The last thing on this slide, I'm sorry. Reward yourself with whatever you like at the end of your study session. That could look like taking a good stretch. That could look like taking a walk. That could look like a guilty pleasure of having a snack. Whatever that looks like, that will also kind of aid in helping to feel better about your study time. There are some textbooks that are recommended or suggested for studying. There's Breastfeeding Answers by Moorbacher, Breastfeeding and Human Lactation by Wambach and Spencer, the Breastfeeding Atlas by Barbara Wilson Clay and Kay Hoover, Interdisciplinary Lactation Care, core curriculum that's edited by Campbell, Lawers, Mano, and Spencer, Breastfeeding, a guide for the medical profession by Doctors Ruth and Robert Lawrence. Now that we have discussed the basics of how to get started, Angela will take a deeper dive into the structure and strategies of preparation. Angela?
Thanks, Sekeita. Okay. Now, sitting for the exam, there are several ways that you can try to remember some of the content that you're going to be trying to memorize. So, for example, there are little tricks called mnemonics, which is to use a word or the first letter of a sentence to remember things. A really easy example is the latch system, which was developed to help breastfeeding workers remember what to look for. So L is for latch, A is for audible swallow, T is for nipple type, C is for comfort, and H is for the amount of help which is needed. I also had a previous student who suggested how to remember which hormones come from which part of the pituitary gland. And the acronym they used were PAP and OP. So PAP stands for prolactin is generated or created in the anterior pituitary, and OP, which is oxytocin, is in the posterior pituitary. So that was an easy way for them to remember which aspects of the pituitary gland produces which hormone. There's also the trick of using the first word of a sentence to jog your memory. This old sentence that you may have learned in biology class may help you remember the number and the names of the cranial nerves. Some of you can use your own to help remember a list of things. There are lists of information to learn, so divide it and conquer. Subdivide the list into smaller segments and consider the rule of 3. 3 items seem to be the easiest number of things to remember. So QBank. QBank is something which is available only through LER, and it's really wonderful because probably by the time you're listening to this, or by the end of December of 2021, we are going to have approximately 500 different questions that our item writers and our instructors have created. And so what you can do is you can go to QBank and you can actually test yourself in order to simulate the exam. And so that's the wonderful thing about QBank, is that it has the question, and we have picture questions as well, and it has a list of, they're all multiple choice questions, so it has a list of responses, and you're able to choose what your answer is. And then at the end of the test, you can see which questions you got right and which questions you got wrong. And we provide you with rationale as well as page numbers so you can learn more about it in the common textbooks. So when you go to QBank, you want to turn off the tutor mode and set it so that it's untimed. So it can either be timed or it can be untimed. Then you can choose how many questions you'd like for each category from the topics in the detailed content outline. So all of the questions are mapped to the detailed content outline. So let's say, for example, that sociology and anthropology are your weak spots. Well, you can create a test which has maybe 5 or 10 of those questions so that you can practice those sorts of questions. So some people, when they start off, they want to take like a 50-question test. Then you can choose what categories you'd like to test yourself. And as I said before, if you only want to study one area, it's possible to set a test up to do that. Then you want to take your test. Now, just like the IBLCE exam, you can mark a question that you're not sure about and that you want to review later before you submit all of the questions to find out which ones you got right. Once you submit it for scoring, then you can see which questions you got wrong, which ones you got right, but you can also see any comments that other people may have made along the way. And we actually monitor those comments on a daily basis. So we do take a look at the comments that you're making, and we try to find a way to help to clarify any information which you might need. So you can do it in tutor mode, you can do it in not in a tutor mode, and you can do it in an untimed way. But also the nice thing is that at the end of it, you can actually choose test mode. And in test mode, you can create an exam of 175 items, and you can take that test so that it's as if you're simulating the IBLCE exam. And for a lot of people, that will help them to feel more comfortable and confident that they can do well on the IBLCE exam. So it's really important to know what is normal. So you want to know what is normal infant weight gain, for example. You want to know the normal stages of development. And the reason why it's important to know what's normal is because then it will help you when you see something which is not typical or abnormal and require an intervention. Study your difficult topics with others, especially those who don't know anything about the subject. So find a sympathetic person and pull out your flashcards. And let's say, for example, that you want to explain the neuroendocrine relationship with initiation of lactation. Well, hopefully the person who's standing there is kind, is sympathetic, but doesn't know a single thing about it. If you can explain to someone who doesn't know anything about it exactly what that means and all the different hormones which are involved and the why and how they work and what is contingent upon the other, then you understand the content really well. Because if you can't explain that concept in general terms to someone who has no frame of reference, then you may want to refresh or go back to the basics and work on a better understanding for yourself of what that concept is all about. You can either do it with your flashcards or without your flashcards. And it's also helpful if you can explain a picture. Let's say that you have a picture and you can actually explain those things to the person who is standing in front of you. And if you can explain those things, then chances are that's one thing you can check off and go on to the next topic. So the basics of the exam, there are 175 questions. Some are regular questions that are related to pictures, and some will be case studies. So there are case study types of questions. And you can find the answer where you will answer one question, and then in the case study, so you're going to answer one question, and then you're going to see another aspect of the same question with that same scenario, and they're going to ask you a different question based on that same scenario. So it's either going to be a case study or it's just going to be like a regular multiple choice question. The questions on the exam are often referred to as items, so you might hear that term being used. You will have 4 hours to complete the exam or 240 minutes. The whole exam is multiple choice question. Each item is made up of a stem, or the actual question, and then several choices, usually 4. The stem of the item can be phrased as a question, a partial sentence, or a best choice. In this example on the slide, The STEM is about the onset of copious milk production. It can be phrased as a question: what is the stage when copious milk is produced? A partial sentence: the onset of copious milk production is called, or a best choice question: what is the best description of the onset of copious milk production? They're all asking about the same concept, just in different forms. And the choices in this example are lactogenesis 1, 2, 3, or 4. So it's important to read the stem of the question and answer the question mentally. Then think about what the correct answer would be. Read the choices. You can eliminate the ones that you know are not correct so they don't distract you. And then you can concentrate on differentiating between the choices that are left. Tentatively choose the first answer on the list that seems correct to you. Then compare it to the other selections to that one. Then compare the other selections to that one. If there is a better answer, then select that one and continue on. Maybe another answer will be even better. Do a final check to ensure that you read the question correctly. If you don't find one that you think is correct, read the stem again carefully. Make sure you understood. The perfect answer may not be one of the choices, so choose the best one. And just venture a guess if you're not sure. Now, it's important to note that all of the information is in the stem, and it's probably there for a reason. The distractors are in the possible answers, not the stem. Watch for words that will change the meaning of what came before. Words such as but, however, although, even though, while, despite, in spite of, or regardless of. Watch the context of the question. An answer might be right, but not correct for the situation. So it's really important to watch the context. So the choices are going to fall into three categories. There's sophisticated distractors and unsophisticated distractors. An unsophisticated distractor is something easy that you might know anyway, or something that's obviously wrong. And of course, there's the correct answer. So there will be three choices to eliminate. Sekeita, do you want to talk about first impressions?
Yes. So, have you ever heard that the first impression is the best impression? I've heard that a few times. I'll say this is sometimes false. However, when it comes to test taking, this is true. Your first thought or answer is usually the correct answer. So try not to second guess yourself. It's very challenging to do because as I started off, I said, your nerves are high, but try not to. So as Angela said, read the stem of the question all the way through, then each possible answer all the way through. I felt the need to repeat that because sometimes with the way we communicate now via text, sometimes the way we communicate via even talking now, the details matter. Reading, so not skimming, read. Be intentional about not reading more into the question than what it is asking of you. Use the answer options themselves to provide you with hints about things you need to know. And be conscious about always scenarios, because rarely is there a situation in lactation that falls into a always category. Usually, and most of the time, yes, but always no, all right? There shouldn't be any all of the above choices for answers, and because they're generally easy to answer and they really don't show the true knowledge of the material. If there is a question that you have absolutely no idea about, you will have the opportunity to flag it. However, don't spend a lot of time on it. You can flag it, make a guess, keep moving. You'll be able to do this easily because this is a computer-based testing. You can go back to it after you've completed everything if you have time. And remember that your first impression is usually right. So be reluctant unless you are absolutely certain. when to guess. When taking a multiple choice test, know when to guess. If you are uncertain of the correct answer, Angela talked about eliminating options. You want to eliminate the options that you know are definitely wrong and make your choice. Again, flag the question so that you can reconsider it at the end if you have time. And if you have no idea, you have about a 25% chance of being correct. But think about, if you eliminate at least one, then you increase your odds to about 33% of being right. So if you're not sure, oh, I'm sorry, let me add too about numbers. If you have a question about numbers that has numbers as the answers and you're not sure about it, think about tossing out the highest and the lowest and then consider the middle ranges. Those are just some strategies of when you're guessing how to improve your odds in guessing correctly. Picture items, the famous picture items. Angela spoke about picture items. About half of the questions on the exam will be based on pictures or a picture. With picture questions, you may have to define a diagnosis or condition, distinguish between normal and abnormal, determine a child's age by posture, size, behavior, or determine a problem such as compression stripe on a nipple due to possibly a shallow latch, or determine asymmetrical breasts as in the example on this slide. Pictures may also be used in case studies where you're asked to recommend a plan of care and decide what you would recommend first or next. The operative words being first or next. And I say that because Angela said sometimes there appears to be two correct answers. Well, which one would you do first, right? So picture questions may take longer to answer than the text-only questions since you have both the picture and the answers to consider. The other thing is pictures can sometimes, we can read a little bit more into them. Continuing on with pictures. So when answering a picture item, you want to read the question first and then look at the image. Sometimes when we look at the image, we kind of all think that we know what they're asking. And I'm just going to provide a little joke here. What if they were asking in that top picture about the flower on the picture? I don't know why they would be asking that, but you want to really read the question to know. It seems pretty obvious what they're asking in that top picture to someone who's practiced before, but you want to read. The question will define what the purpose of this particular picture is. And so you'll be able to focus on the question. And you'll be able to focus on what the question is really asking you. If the answer is not immediately obvious to you, visually divide it into quadrants and look at each quadrant closely. Images may not be as obvious as the picture at the top, which is massive mastitis. A more likely image is the redness seen under the nipple on the image at the bottom. It's a little bit more subtle. So read the question first and then look at the picture. Keep in mind that the images are not perfect and some may appear dated. Some may not even seem clear to you. However, remember, the IBLCE is comprised of IBCLCs. They have thoroughly reviewed the questions and images to ensure that all the information is there for you to answer the question. Clinicians who take photos to teach breastfeeding concepts have shared that it is sometimes challenging to get good clinical images with proper lighting, setting, and context that are all crystal clear. Common problems that test takers run into. Again, first, reading too much to the question. I said that before, try not to read anything else other than what the question is asking. Take it at face value, that all of the information they want you to consider is in the STEM, is in that question. There is a saying, especially for those who live in the US, that it says, there's a saying that says, don't look for zebras in New York City's Central Park. What that means is look for the most common likely answer. This was reiterated by someone who recently took the exam, and they stated it as this: the likelihood that a parent or baby is presenting with something rare or exotic is very low, compared to the likelihood that it's, let's say, maybe mastitis, what I just showed you in the picture, or a plugged duck. So prepare yourself for everyday scenarios. Be conscious of those qualifiers, as Angela spoke before. Answer the question they're asking. And that might seem obvious. However, I have missed questions that I knew the answer to because I didn't really pay attention to what they were asking, such as, what would you do best? Or what is the best solution? Or what would you do next? So, as Angela said, reread the question before you make your final selection. Sometimes your mind will go blank. Don't panic. Remember, I talked about taking that deep breath. That may seem second nature to some, but not so much to others. I know sometimes when I get nervous, the first thing I do is hold my breath. So take a breath, don't panic, proceed logically, and again, eliminate the wrong answers and make your best choice. For those of us who are advanced practice nurses or midwives, physicians, remember you need to answer the question like an IBCLC. And this is tricky when you've been practicing for many years. I can say that I took the exam, I had to retake the exam after 10 years of certification, and I studied hard, and I'm glad I did. And I was practicing as an IBCLC in a hospital setting. So don't put it off. Think about the common problems. Think about all that is presented to you today, and hopefully you will prepare and you will be calm and you will be ready and confident. Angela?
Thanks, Sekeita. So yeah, Sekeita's talked already about all the different things that you can do if you're stuck. Again, taking a deep breath is really an important thing to do. You want to read the STEM and the choices, look for those adjectives, those qualifiers, and do, if you need to, though, move on and come back later. If that one is just flummoxing you, then just take a moment, take a breath, move on to the next one, and then hopefully as you're working through some of the next items, you'll remember what the answer is previously. And so now we're going to talk about exam content. And so when we're talking about, this is my favorite part. So I just want to give you a little bit of background about what the IBLCE exam is and how they structure the questions that they have created, as well as the detailed content outline. So the exam is known as a reference-based exam, which means it's based on the current medical literature. Based on the literature, such as current textbooks, take a look at the compendium of research that's been validated, peer-reviewed, and in the pipeline over the past few years, as well as the Academy of Breastfeeding Medicine protocols. Now, things which are not included are unvalidated research. That means additional study has not been done to support the conclusion, or additional research did not support the original study. Anecdotal materials, verbal statements, websites, conference presentations. The only things that are written and in peer-reviewed journal are included. The textbook, such as Nancy Moorbacher's textbook on breastfeeding answers, or the Spencer and Wambach book, Breastfeeding and Human Lactation, for example, are evidence-based textbooks. Don't go down a rabbit hole and think of the ifs and the buts or the one-off presentation. If you hear yourself say, well, I heard of a case where, you're going down a rabbit hole. So the exam covers all the topics that relate to breastfeeding and lactation. please go to the IBLCE website to the IBLCE documents section and access the detailed content outline. You can print it out if you wish. I know there have been previous groups of candidates who will create a Google Doc and have others add relevant content in the outline. One of the in this previous LER group, they started the Google Doc and they posted it in the discussion, and they gave everyone access to it. And as relevant facts came up, they would be added into the outline where it fit best. I met someone at a conference prior to their sitting for the exam, and they had printed it out and they had put it in their conference bag to review during downtimes. So there are ways to get that studying in. So I created these labels on this slide from the information from the IBLCE test analysis report. They publish a broad overview on exam performance a few months after the previous exam. So I have this information here to show you how well people do on the exam by cohort. So take a look at the number of people who passed. Most people pass this exam. In April, 81.31%, and in October, 72.55% of people passed the exam. Why is there a difference between April and October? It has to do with the language in which people are sitting the exam. And so the translations occur in the second exam of the exam year. So one note, you'll see the research by exam group, the data is a bit skewed. So those are people who are taking the exam at the 30 or 35 year mark. There were 14 of them, and 100% of them passed. Regardless, that cohort scored best on the exam. Now, it doesn't hurt that they've taken the exam more than once. While the questions are not the same, these people have been around for a minute, and they probably are the lactation educators, such as myself. As most mentors will tell you, students keep us fresh and on our toes regarding the latest evidence. So you'll notice here that 240 minutes to complete the exam. In April, there were 175 items, and the cut score was 125. And I just realized that I read that, and that was from my note, as opposed to information which is on the data. So I'll go ahead and move on. In analyzing the exam results from all candidates from 2 consecutive years, you can see how these topics, the topics that give people the most difficulty. So look at the topics that scored below 75%. Immunology and infectious disease, growth parameters, and developmental milestones. Now there was a slight shift in pathology, which dropped, pharmacology and toxicology, which improved, psychology, sociology, and anthropology, which declined, and interpretation of research improved. These are areas where you might want to spend a little more time. One common question is, well, what area should I study? You can see here the number of items for each discipline. This will give you an idea on how the test is weighted. IBLCE has a range on the number of items in any given discipline based on the latest practice of current IBCLCs. IBLCE chooses the specific number of items included in each discipline year to year, and that information is confidential. The exam also covers all of the chronological periods, from preconception to toddler, with the majority of questions clustered in the early newborn time frame. So here are the test scores for those chronological stages. While you can see that there are some areas of improvement from year to year, for example, with the 15 to 28 day group, and a decline, such as prenatal setting, it appears that candidates are very good in the first few days, but seem to have more difficulties with older babies. Find or ask for pictures of babies at stages you do not currently work with, such as the Stanford University Library has images of these infants. The CDC library does as well, especially regarding developmental milestones, and the Breastfeeding Atlas, which is one of our textbooks. And take a look at those babies and just quiz yourself. If you're not experienced with older babies, try possibly attending a support group with permission to observe and to listen what these parents are talking about. So, as Sekeita and I have both said, don't panic. You may be asking yourself, what should I know that I don't know that might be on the exam, but I don't know? Remember that you will be prepared. Believe in yourself. Haven't the families you've already worked with benefited from your care? Pace yourself, Take your vocabulary words with you everywhere you go. Use little pockets of unexpected time to study. Watch for signs of excessive stress. It's really important. These symptoms can be mental, social, and physical problems. It can show up as being forgetful, confused, agitated, or spacey. Social stress can show up as being irritable, argumentative, or withdrawn. Stress can also show up as physical problems such as cold sores, bladder infections, eczema, GI upset, or even catching a cold. Do what works best to reduce your stress, so you don't look like this person on the picture. Okay, great. So we're going to open it up for questions. I know many of you have been asking questions throughout, and I know Julie, our wonderful support person, has been answering those questions, but let me take a peek here and see what is here.
Angela,
okay, someone I know
a
asked.
question.
Go for it. Thank you, Sekeita.
Oh, I was just going to tell you the question, but you see it already, so there you go.
No, which one? Is it the question about the acronym?
No, I was referring to will questions about COVID-19 be included in the spring 2022 exam?
Ooh, that's a good question.
That is
normally I would say, what would you say? I have an idea. What do you think?
I would say that right now, I can't. I wish I had a measure. I wish I had like some type of ball that I could tell you that question. But what I will say is know the basics. COVID right now is the recommendations are clear to continue providing human milk. I would say if there's any question, that is where you want to go with that. I, however, I don't know to be 100%. So I would say just always, if there is a question, it is not contraindicated to, so know what, and the other thing too is this is an international test to keep. So recommendations on what to and how to is going to vary. So I don't think it will be extremely detailed on, what you should do, what the recommendations are, again, because this is very fluid. This is a pandemic, and as information comes out, it changes, and it's been changing rapidly. So I would say no, but I cannot guarantee that won't happen.
I would agree with that, Sekeita. I would think that it's important to know what the WHO recommendations are. I know that in different states and provinces and different areas around the world that the recommendations may be different. And so you do want to follow those international authorities. The IBLCE exam is an international exam. So it's not what's happening in your backyard, but it's what the general consensus is for all of these topics. So great, yeah. Thank you. Angela, that's a really good question.
Mm-hmm. Yeah, it was. Can you review where to find images again?
So you can find images on the Stanford University website. They have images of babies. Also, the CDC, in the United States, the Centers for Disease Control and Prevention, they have a list of developmental milestones along with images, as well as pictures, as I said, images, pictures of children who are doing different activities at different ages and stages. And so since that part of the exam is usually one where people don't score as well, I think it's really helpful to know what those ages and stages are. Granted, if you're somebody who works in the community and are very familiar and comfortable with those older nurslings, then that may not be an area where you need to focus. So hopefully that helps. Oh, and also the breastfeeding atlas.
Yes.
Okay. A previous question asked about what the acronym LATCH stands for. Do you want to answer that, or do you want me to?
You go for it.
Okay. L stands for latch. So actually how the baby is latched onto the breast and the ease of the parent being able to latch the baby onto the breast. A is for audible swallows. So can you hear the infant swallowing during the feed? T is for type of nipple. So what sort of nipple does the parent have, and describing it is helpful. C stands for comfort. So what is the comfort of the parent as the baby is attached to the breast? And then H is for help. So how much help do they actually need? And so help meaning is the parent just there, and the the supporter is the one who's actually holding the baby and or supporting and or instructing the parent as to how to latch the baby onto the breast? Or does the breastfeeding supporter walk in with their hands behind their back and is just sort of visually assessing whether or not the baby knows, or the parent knows whether or not how to latch the baby onto the breast? And then each one of those letters is ranked either a 0, 1, or 2. And so the highest score is a 10 and the lowest score is a 0. It doesn't mean that someone with a 10 has got it going on necessarily, although I would say that they do. But in that feeding, that may be a really good feeding. And so that would be an indication. That's the way some people will chart it, especially if you're working in an electronic medical record in a hospital or some other facility. So that way you have a general indication as to whether or not it's necessary to intervene in order to help the parent further. So there's a lot of information about latch scores and different scores and the validity of that information. Okay,
I'll
great.
answer
What else?
this question about YouTube. The YouTube channel, it's just Lactation Education Resources. And then there's another question about how long will it take to get results? That's a lovely question. It takes a long time. It'll seem like forever. But it takes about, Angela, it's about 3 to 4 months, 4 months, yes, for results to come back. And that can seem like forever.
And I say 4 months because it really is closer to 3, but it's going to feel like a lot. It's going to feel like a really long time. And actually, we've written a blog about the why. So I won't go into the why here, but I did go into the why in the blog post. So do take a look at the blog. Go to lactationtraining.com and take a look at our blog. I believe the link for it is down near the bottom. Okay. Oh, Sekeita, I think this is a really good question for you.
Mm-hmm.
Where can I find current peer review research?
Wow, you can go to Cochrane database. You can go there. You know what? The Journal of Human Lactation, Clinical Lactation. There's several lactation journals. And also, if you think sometimes about lactation is multidisciplinary. So ACOG has journal, which is the American Colleges of Obstetricians and Gynecology. Nurses have, so you can find a vast array, but I would say you want to do breastfeeding medicine. They have journals. Journal of Human Lactation and Clinical Lactation are your key journals for lactation.
Oh, and there's one more, the International Breastfeeding Journal as well. So that's
Yes.
Another one.
Yes.
That one actually is open access. And the nice thing about clinical lactation is that it's open access after the first year. Mm-hmm. Now, some of these groups require a membership in order to get a copy of the journal, but that's a really good place. Also, the Academy of Breastfeeding Medicine is a really good international resource, and they have protocols, and those are reviewed on a regular basis and updated on a regular basis. And so I would say going to those ABM protocols, and the website is bfmed.org. That's another good way to find it. I would also say that the textbooks that Sekeita referenced earlier are updated every few years. So in other words, if you have, for example, an older edition of, let's say, breastfeeding and human lactation, it may suffice, but know that the latest information is in the latest journal, or is in the latest textbook. And so do know that if you have a previous version, maybe one-off version, I don't know about a two-off version, you know, if it's been like maybe 8 or 10 years since that book was actually published, there may be enough which has changed where that textbook may not be your best friend. And so do find a way to get a resource that is something that you can reference. And it's not necessarily something that you're only going to use for the time to study for the exam. Find a resource that you can utilize when you're actually doing your work, depending upon what setting that you're in.
There's a question about, what do research questions look like? What would you hone in on with studying to prep for research questions? So I would say know the difference between quantitative and qualitative research. And when I say that, I mean knowing how to apply it. So let's say I gave you a study and I told you what it was all about. are you able to tell me based on the scenario where this would fall in? The other part about research is what you want to study and think about is how to know if the study that you're studying is valid, is reliable. So those are key things that you want to know. If you're reading a study, anybody can study anything, but do the results make sense? Is this something I should say, yes, this works, or no, I'm throwing that out with the trash? So that's how you want to look at research questions.
Yeah, that's a good one. And also, Sekeita, I believe that we had that we recently have updated our research lecture on interpreting research. I think we've recently updated that. So if you need to take that lesson, you can. And that actually dovetails nicely into, you know, someone says, what is the best LER course to take for a lapsed IBCLC? And I want to reassure people that indeed we do have resources, and the exam review enriched. So we have two different exam review offerings, and the one that is an exam review enriched actually has webinars that go along with it, and they review each section of the detailed content outline. So that would be an opportunity for you to be able to, you know, bone up on it. If, for example, you just want to know about research and you only want to, that's the only place you need to focus, then know that we sell all of our courses individually, meaning the interpretation of research, while it is part of our lactation consultant training program, we sell just that module. And so if you'd like to, you can go and you can listen to that module in order to find out more information. Someone also mentioned here Biomed Central. That's another good place to go for additional peer-reviewed information.
Someone asks, what's a good way to remember drug information?
I'm glad you picked that question.
Because I try to stay away from remembering, but I know why you would want to remember. But think about this. There's very rare cases where drugs are contraindicated. So you want to think of it like that. Think about the drugs that are contraindicated. Yes, you want to know those, right? It's impossible to know all drugs, but you can know classes of drugs. And so Angela and I have done a live before where we talk about certain medications, how they're classified based on HEL. So I want to say that you won't be quizzed on like the mechanisms of how drugs work, right? You want to know if this is compatible with lactation, or mostly those things that are contraindicated. If you know what's contraindicated, then all the other stuff would be like, oh, okay, yeah.
Right, that's true. And I think that it's important to note that it's both prescription medications as well as over-the-counter medications, as well as any other substance that a person may ingest in order to help or alter their physical or mental health. So yeah, good. Okay, great. Oh, and Julie also, thank you, Julie, for putting in that answer. I'll go ahead and read it out so that everybody can hear it. Someone asked, is there a lot of statistics on related questions? And so the answer is that she put in, which is so wise, is it's good to remember that this is a lactation exam and not a statistical exam. Really, the important thing to remember is the p-value, which makes a study valid, and differences between qualitative and quantitative research, just like Sekeita said. And you will not be required to do math, which is true. You will not need a calculator. You will not need a pencil and paper in order to figure out the issues, right? You will not have to do math. This is a lactation exam. And so it's the application of the lactation information that you have more so than anything else. Excellent. Well, I think that's it. I think we answered all the questions.
I think so too. I don't see any other flagged. I don't see any other questions. So yeah.
Beautiful. Thank you so much, everyone, for joining us today. We hope this has been helpful. Please do start planning today for the exam, which is going to be in probably a little over 100 days. So please do start planning now, or if you're watching this video, a few weeks later, go ahead and get started. Anytime you get started, you're going to be ahead of the game. And do let us know what we can do to support your journey. Anything else, Sekeita?
Just those 5 P's. Proper preparation prevents poor performance. That's it. Thank you for joining us. Bye-bye.
Good one. Have a great rest of your day. Bye-bye.